I try and find out, this is a dazzle reflex. Light is the last thing that they lose, and he doesn't really respond to me in either eye. Okay, so let's go ahead and turn the light out. Let's take a look inside of his eyes. Oh, my little friend. Good boy. So his lens in his right eye is what's called subluxated, meaning I think what's happened is that his eye has stretched out. I think he has glaucoma in both eyes. And we'll go ahead and check his pressures here in a moment, but what I think is his eyeball has stretched out so much that the ligaments that hold the lens in place, many of them have broken, because it just can't stretch anymore without some of those ligaments breaking.
Is that painful for him?
The glaucoma can be very painful.
Poor baby.
But they just survive and adapt.
Mm-hmm. Probably for a while he's been adapting, you think?
I do.
Yeah.
If this went on unchecked, what happens?
Unfortunately, the eyes will often just stretch bigger and bigger and bigger, and they're just chronically painful and blind. And in some cases, they'll get an ulceration on the cornea that's bad enough that the eye will rupture, but not necessarily just because of the pressure. I don't think he blinks very well. He has some hair on his cornea because his eye is so big, particularly the left eye is so large that I don't think he can keep the cornea protected. I know, sweetheart. And again, the lens in the left eye is also subluxated. So again, the lens is suspended inside the eye 360 degrees, and when it starts getting bigger and bigger, many of those ligaments that suspend the lens, they just can't continue to stay in place, and they do break. So let's try and take a look at his retinas. Let's turn his head over there. Hold on, sweetheart.
Okay, buddy.
It's alright, you're alright. I know, we're just trying to look, okay? He definitely has a lot of damage in his retinas.
Do you think it was from a particular incident or just over?
Well, and we'll check and see. My suspicion is that he may have been born with a risk to have this disease. I don't know if that's why he didn't have a home. And again, I'll check his pressure here in a couple minutes, but all of this is so consistent with him having glaucoma. It's much harder for me to see his retina in his left eye because of the scarring in the central part of his cornea.
What exactly is glaucoma?
It's elevated pressure inside the eyes. And so it can sometimes be mild, sometimes it's very severe. But in his case, again, I'm suspicious that it's much more severe. Let's check his pressure.
So pretty.
He's so sweet. Yeah. I know, I'm sorry, honey.
Oh, he is sweet.
The pressure in his right eye is 58. And in his left eye is 56.
Sugar's was like 3 or something.
Normal pressure is typically up to 25. Okay, so he has glaucoma, and I do think it's causing him discomfort, and it has also affected his vision. And I think his vision is permanently damaged. Okay, so let's go ahead. Let me check his tears, and we'll check his corneas as well. Oh, isn't that nice?
He loves other dogs.
Okay. Okay, great. So these are just to check his tear production, and we'll do this for 60 seconds. And we'll find out if he has dry eye because, you know, the glaucoma is his biggest problem. Mm-hmm. But if he has dry eye and he has glaucoma, we're going to have to decide what's the best thing for him in the long term, because I don't think that these eyes help him anymore.
Right.
Okay. So we're 13, so we're low on the right, and he has more discharge on this eye consistent with dryness. And he's just normal in his left at 16. Okay, so 13, 16.
That's surprising that he has...
That he has enough tear.
Yeah.
Well, and that's the surface of his eye, but it also makes sense as to why, you know, he has a lot of that crusty discharge in his right eye, because most dogs with dry eye will have a lot of mucus, but he can also have some mucus from his glaucoma, okay, and his discomfort. So let's go ahead here and take a look at this.
Not only that, but he's putting up with rotten teeth.
Oh, poor
So
guy.
imagine how his whole face hurts.
Oh,
and he's just so happy go look. He just, every time I've ever seen him, he's just so happy.
And he has a little area where he had an ulceration in his right cornea before, but it looks like it's healed over. Okay. And then he just has, again, a lot of change. In this left eye, you can just see how I can hardly even move his eyelids over his cornea to move that material out of the way, let alone him blink well enough.
Wow. Oh, poor guy.
Test called gonioscopy, and that test will help us look at the drainage apparatus in his eyes to try to determine if he has primary glaucoma, which he was maybe born to have, versus if he has secondary glaucoma, which was due to another cause. At this point in time, discriminating between one versus the other, it's almost a moot point because he has the glaucoma, his pressures are elevated, he has severe damage to both of his eyes from the glaucoma, and again, at this point in time, he doesn't even show me light perception, which is the last thing that they lose. So at this point in time, I think we need to focus on what can we do to get him comfortable. And our choices are to start him on medication, because I think that's typically how we want to start most of our patients. It gives us time to make some decisions. Do we want to deal with this problem surgically and get it taken care of and make it, make a permanent decision for him? We can try medication. The problem with dogs with glaucoma is that many of them respond well to the medication initially, but they may not be maintained on medication forever. So now we have to think about him and what the best thing is for him, especially if we're trying to find him a home, finding him, getting him taken care of so that he doesn't need a lot of ongoing maintenance care, or finding somebody who's willing to do that maintenance care for him. But the glaucoma now, it's not about saving his vision, unfortunately, it's about comfort. So we have to focus on that.
And the options of like a permanent decision would be if the medicine wouldn't work, would be to remove
Could
both.
be removing both eyes, and then you negate the need to do any other treatment. You've taken care of the problem, he gets on with his life, it doesn't change his life.
Right.
Because he already is blind.
Right.
And so it's a matter of getting him comfortable, and typically when we do that surgery, we put a little silicone implant into the socket, and then the lids are stitched closed, so he just basically looks like his eyelids are closed for the rest of his life. And many pets can be groomed so that the hair can come over the eyes, and so it's not so noticeable. Other options include salvaging the cornea and the muscles that hold the eye in place, and so that he can blink and he can still move the eyes, but actually removing the contents of the globe, it's called evisceration, and then placing an implant inside of that so he still blinks, his eyes still move. He looks about the same actually, but he does not have the pain of the glaucoma. That is a little bit more of an invasive procedure, and it's also a cosmetic procedure. So we're doing that so that he has an eye to look at. It doesn't fix him, it doesn't bring back his vision, but it's something that some people find very appealing. We can freeze over the part of the eye that makes the fluid in his eye, and that's called cyclocryothermy. And the goal with that is it's a less invasive procedure. We actually take a cold probe and we freeze over the sclera, which is the white of the eye, in several areas to try to reduce the pressure. The downside with that procedure is that he still has parts of his eye that can make fluid, and he still has most likely a bad drainage apparatus in his eye, so he still potentially could have glaucoma down the road. It's not very common that that happens, but I always want to warn people that that could happen. And then the last option is actually to do what's called a chemical ablation, where we can actually inject something inside of his eye to try and kill the cells in his eye that make fluid. The problem with that, same issue. You still have cells inside your eye, you still have a drainage apparatus that doesn't work, so some of those animals can still have problems. We're also limited with him because of his size. He's very small, and the dosage of medication we usually use to perform that procedure, that is a medication we have to be very careful with their kidneys and things like that.
Right.
Okay.
Right. And as far as we know, there's no blood work on him, or a urine analysis.
Okay. So I think those are some things. I think typically in his situation, we start him on medication. In the short term, let's get the other things checked out, get his blood work checked. Let's then continue to think about what we want to do for him.
Okay. I mean, I always like to ask this, but if he was, say, your pet, what would you do?
Well, I love the cyclocryothermy procedure. I think it's a great procedure because it is less invasive, but I also have to think, if it were my pet, but maybe that we're going to go live with my family, I don't know that they'd be up for medicating and watching him, and he already has so much change to his eyes. I feel like he'd be just as happy having the eyes out. And I think you then don't have to medicate for dry eye. You don't have to put any medication in the eyes anymore. So I think some of this depends on maintenance. And if it were my pet, I might be willing to do more maintenance than somebody else might be willing to do.
Right.
So I think that's something that we really have to take into consideration when we make a decision for him. What's best for him, and what's best for maybe his future situations.
Okay.
And when the eyes are taken out, Is there anything that can come along with that that's negative that could
low risk of infection,
low risk
of stitch reaction? And anesthesia is the thing that we have. But for most of the alternatives, we'd have to have general anesthesia. So typically, success rates are 90 to 95%. Yes, things can happen. It's just not common.
Yeah.